So working on the back of the legs, I've got her kind of spread apart so that I'm not banging into her leg with the tool. I do really like the biggest paddle blaster for the broad parts of the leg. Really any broad surfaces, it tends to work really well to warm up the tissues. You can just, it really depends. It's kind of like a massage. If your client really wants work in the glutes, and I know that she does want to focus on here as well, so I've asked her and she's comfortable with, you know, moving the panties around. You can also use draping during fascia blasting and drape the way that you would for massage to get access to any areas, if you don't want to have to be moving underwear and moving them back. And then also I wanted to show you kind of the technique is, you know, it's going to be different on people with different tissue texture, and so sometimes, you know, the tissue wants to get away from you, like here, and so you're just going to put a little bit more pressure, and we'll get to the glute work as well with side lying, and that'll kind of the way that the hips push the glutes out and side lying will allow us to get a little better access to the glutes. And one other thing is that you may notice, you know, if someone's got cellulite or you know, kind of more bunchy fatty tissue or lipomas, you know, anytime we've got lipomas in the body, these little kind of fatty lumps, and we're not sure what they are, it's always good to, you know, ask the client, hey, have you ever noticed this before? We always want to be careful with verbiage and just go, hey, you've got a lump here. And you might just say, this tissue feels a little different than the tissues around it. You know, have you noticed that? Or have you asked your doctor about it? And definitely, you know, ask them to talk to the doctor about it if you notice something that just doesn't feel like the rest of the tissue around it, or that feels like it could be either a lump or a blood clot. You know, especially working with the legs, that tends to be an area where blood clots can live, and we don't want to release them, especially as we're doing deeper work in the fascia with the deeper tools especially. So if you notice, you know, a lot of blood vessels or veins kind of in one area, and any type of raised tissue or a lot of blood or heat in that area, I would just avoid it the first time. Ask the client to see the doctor and talk about it before you would work in that area. And also being mindful of, so like if that were the case and I knew that there was something here that I was concerned with, I wouldn't want to do work inferior to that as well. I wouldn't want to be sending blood up through that area, so I would just avoid that leg for that day and ask them to see the doctor about it before we continued. And usually, you know, doctors will look at it and say that's fine. You just want to, you know, protect yourself and your client and make sure that it's checked out with the doctor first if there's anything of concern. And so when I go over this area, is that uncomfortable?
It's not at all.
No, okay. So, you know, this is a joint, but since it's basically, you know, the same as if I was gently rubbing over the back of the leg. So I'm not going to be putting deep pressure in that area, but I can kind of use the tool over this area without causing discomfort.